Okay, so here we go. Well, welcome everybody, and thank you for your interest in volunteering with End of Life Washington. We are here today to tell you a little bit about the volunteer roles that we have available right now, so that you understand them before committing to one. We just find that that makes the whole process a bit more seamless for folks. And before I get started, my name is Daniela Miranda, and I'm the Community Outreach Manager at End of Life Washington. And that just means that I work on providing education and outreach to different populations around the state about end of life options and advanced planning. Okay, so let me get started by just going over our mission. So End of Life Washington is a statewide nonprofit that is primarily fueled by volunteer work, and most of our budget comes from individual donations, although we're trying to broaden that a little bit. And our mission is to ensure that all Washingtonians have access to a range of end-of-life options, and that includes death with dignity, which we prefer to refer to as medical aid in dying. And we do this through three main areas. So as I said before, we provide education and resources to folks around the state. We also provide one-on-one support for folks who are looking to access the Death with Dignity Act, and we'll talk more about that in a second. And then we also are very active when it comes to advocacy. And End of Life Washington was instrumental in getting the Death with Dignity Act passed in 2008, and more recently, an amendment to that original Death with Dignity Act passed last year in 2023. So with that, I'm going to tell you a little bit about our first group of volunteers. So as I said, I mostly work in education and outreach, and of course I couldn't do what I do without our fantastic group of volunteer educators. We call them ambassadors. And right now I believe we're up to probably 30 folks in that role. And what they do is they provide outreach and presentations to different organizations, community groups, professional organizations around the state. Those, we call those tailored presentations, right? Because they usually come from specific groups. And we do those in person or online. It depends on the request, right? And to give you one example, we have a partnership with the Washington chapter of the National Association for Social Workers, where we commit to giving 3 presentations every 6 months for them, tailored for social workers on topics related to medical aid in dying, advanced planning, and end-of-life options. In addition to that, we also facilitate a once-a-month virtual presentation for a general audience that we call End of Life Ready. And that just covers the basics of advanced planning and end of life options. We, of course, again, touch on medical aid in dying and voluntary stopping eating and drinking. So again, that presentation is facilitated by our volunteers most of the time. And as I said, that attracts just general folks in Washington State and beyond who are just looking for information to get started, usually with the process. Something else I will say is that when it comes to training ambassadors, that training process is fairly simple. So after you submit your application, you go through the onboarding process. What we do is we set up a meeting between the interested volunteer and myself. I send you some materials in advance, and during that meeting, you have the opportunity to ask questions about the materials, about the types of presentations we offer, and then you will have some time to also do a practice presentation, let's say, of the end of life ready content, just to work out any issues that the person might have with the content. And after that, you're invited to attend our monthly ambassador meetings, and you're welcome to, if you're ready, start signing up to facilitate presentations. So again, this is just a very quick overview of what ambassadors do. And with that, I'm going to hand it over to Rebecca to tell us more about the other 2 volunteer roles that we have available.
Hi folks, yes, thank you for watching this video. My name is Rebecca. I'm the Client Services Manager here at End of Life Washington. So I really lead our direct services, navigating, connecting clients with the volunteers. I also work with Danielle to onboard all of the new volunteers and lead training our volunteer client advisors. So the two roles that I'm going to talk about are the phone volunteers and the volunteer client advisors. I'll start with the phone volunteers. They're really the first touch that many people have with End of Life Washington. We are unique, I think, in the world that we try and have a live person answer the phone during most of our business hours. So Monday through Friday, 9 to 4 p.m., there is usually someone at the other end of the phone line for people to call. Phone volunteers sign up for a shift, either a morning shift or an afternoon shift, or both if you're just really enthusiastic. You sign up like about a month ahead of time for however many shifts you want to take. This is something that you do from home. We will transfer the phone line to your phone, and we can have a system set up so that you can make phone calls back without divulging your number and all of these things. Nobody gets your personal number, but it is a thing you can do from the comfort of your own home. Phone volunteers deal with all sorts of different calls because people call us for all sorts of different reasons. They call because they are interested in medical aid in dying or voluntarily stopping eating and drinking. They call because they just need general advice on end of life planning, on advanced directives. Sometimes people call for things that aren't really in our wheelhouse. They call because they need an estate planner or financial advice or help with their wills. So it's really the phone volunteer's role to just get some basic information about what's going on with somebody and then direct it to the right person. So that can look like reaching out to me in client services and saying, hey, this person, has questions about this. That can be referring them to 211, to legal help, to whatever they need to do. We provide you with a list of resources that you can provide to folks. The other thing that our phone volunteers do is help fill out online intakes for those folks that need help with it. So we ask all of our clients to come to us via our online request for support form. Clients often fill it out for themselves. Sometimes a family member, a friend will fill it out. Sometimes a healthcare provider will fill it out for them. Sometimes folks either can't access the internet, don't have a computer, or just struggle with filling out the form or getting somebody to fill out the form for them. So if you have a call with somebody who is interested in medical aid in dying or voluntarily stopping eating and drinking, you ask them some basic qualification questions. Are they 18? Do they live in Washington? Do they have a terminal diagnosis? And they say that yes to those questions, you go to our website, and while you're on the phone with them, you just ask them the questions on the form and type in their answers and hit submit, and then I take it from there. Daniela does a wonderful phone training that I think we have recorded that everybody can watch, and we have a manual with more information on that as well. So the next role that I will talk about is our volunteer client advisors. So our volunteer client advisors are our main direct service volunteers. We have about 74 of them now. They are divided into geographical regions. So they're like a Eastern Washington team, there's an Olympia team, there's a Tacoma team, there's a Vancouver team, there's a West team, there's a Whatcom Skagit Valley team, and then there's a Seattle team. And the Seattle team is actually divided into some regional subgroups just because it's such a big area and we have so many volunteers there. So when a client reaches out to End of Life Washington, interested in either medical aid in dying or voluntarily stopping eating and drinking, I connect them with this volunteer client advisor. That looks like me sending out an email to your team or to your sub team and just saying, hey, who can take this client? And if you have time, you step up and say yes. The amount of work that it takes per client is incredibly variable. So some clients come to us from a supportive institution such as Fred Hutch, and they actually already have their provider. They've already done their VIN request. They maybe even already have their meds, and they just need someone to ask them questions to, and then somebody to be there on the day of ingestion. Other clients come to us just saying, I just got a cancer diagnosis. I want the pill. And you're starting at the very beginning of basic education about what medical aid in dying is, what the medication is, how the process works. And you're working to connect them with volunteers, you're working to get them into a hospice, and there's a lot more legwork involved. This role is hard for folks that work. I will just be transparent about that. We do have some people that work and do this role, but it really does take having flexibility and available time. So if you work, but you have a really flexible schedule, if you kind of like make your own hours or in self-employed, that kind of thing, it could work for you. But if you work a sort of standard 9 to 5 job, this might not be the best role for you to start with. It's up to you how many clients you take at a time, but it's hard to know going into something whether this individual client's going to be just a couple of hours of work or it's going to be months and hours of work. We do work as teams, so you always have support and backup, but we really do ask that people have the ability to commit to spending a good amount of time, have flexibility, and have willingness to be flexible in their schedule. We really want to practice client-centered care, so we always try and meet clients where they are. So we do go to them in person if they want in-person visits, and we try and schedule those visits around what works for them. So the more flexible your schedule it is, the better. Daniela, what else should I say about voluntary client advisors? I'm sure there's important things I'm missing.
I was just going to ask a follow-up question that we get a lot, which is how is a volunteer client advisor different from a desk doula?
Oh, that's a great question. So our volunteer client advisors really are in a narrow lane of helping somebody access medical aid in dying or voluntarily stopping eating and drinking. So we don't do things around vigils or rituals. We don't talk to people about planning funerals or celebrations of life or that kind of thing. We can give them resources and we can kind of give them a little bit of guidance, but we're really just in the lane of doing what we need to do to get them access to the medical aid in dying medication or to get them set up to successfully complete voluntarily stopping eating and drinking. The training for volunteer client advisors is much more in depth than the training for either phone volunteers or ambassadors because it's just a much more in-depth role. So it starts just like all the other ones with a volunteer application and then an interview with client services, which is usually me. And then you attend a training. And I will say right now, we're actually revamping our training. So I don't know exactly what that's going to look like. It has traditionally been a day-long 9 to 4 p.m. online Zoom training. And you should anticipate that it will be at least that many hours, though we plan to probably break it up. So I would say anticipate somewhere between 8 and 12 hours of online training, probably a mix of self-paced, do it at your own, and live needing to be in the room meeting with us and the other folks that are training. After you complete that amount of training, you're welcome to start shadowing. And what shadowing looks like is you go out with experienced VCAs. So when the emails come out, you say, I would love to shadow on this. And then you go out and do initial visits, follow-up visits, and day of ingestion, death days with experienced volunteers. You keep doing this shadowing role, and you can kind of slowly start taking on more and more responsibility until everybody feels comfortable with you moving to the next step. So you feel comfortable, you feel ready to take on a client on your own. The folks on your team feel like you're ready to take clients on your own. You've met with me and we've chatted about it and I think you're ready. And then you become a primary VCA and you start taking clients as the primary. But even at that point, you're still going to have somebody experience with you for your first couple of clients. So you're in the lead, you're kind of arranging things and navigating things, but you have a really experienced person supporting you there to answer questions. And again, you do that until everybody feels like you're ready to go. And then you can start taking clients solo and eventually taking the new folks that are coming in after you out and being their lead as they're your shadow. This process can take anywhere from 3 months to a year or more until you're ready to take clients on your own. It's really dependent on just how many opportunities you are able to say yes to, how sort of what's involved with those clients and how many meetings you have with them, how ready you're feeling, how ready the team's feeling. It's both an art and a science. So sort of there are some basic requirements we ask of you of things you're able to do, things you're able to answer and know about, but also it's a lot of just like how do you feel about it, or do you feel ready? The other part of this role that I want to talk about is our database system. So we do have a online database system where you are expected to go in and document all of your encounters with clients and encounters with people associated with your cases. So hospice social workers, providers, anybody else that you might be working with. So there is some logistics and some paperwork and some bureaucracy involved. As Daniela said, this is not a death doula role. This is not so much sitting at the bedside holding someone's hand. Sometimes we do that on the day of ingestion, but it's a lot more phone calls, emails, navigation, working to coordinate what's going on with somebody. And there is still lots of space for support of both clients and their loved ones. There is certainly time to sit down, to talk through things with them, to listen to their concerns, to share information that they need. We just want to be clear that there is a very distinct difference between the sort of death doula type of role and the volunteer client advisor role.
Thank you, Rebecca. I do have one more question that I think folks might have, and that is for the volunteer client advisor role. Does that require travel?
Oh yeah, that's a great question. So it does. So as I said, we are divided into geographic teams. That said, the areas that we cover are pretty big. Washington's a pretty big state. So we do ask that folks at a minimum be willing to travel at least an hour, ideally more, but we do need folks to be able to travel at least an hour just to make sure that we're able to cover all of the areas that need coverage.
You. That clarifies it. And I would say, just to summarize, fund volunteers don't need to travel. Ambassadors will usually need to travel. Yeah, we hope you can at least travel an hour from where you're located, hopefully more, right? But we just handle that based on where we're getting the requests from and who's available. And before we close, one last thing I want to stress is we provide training for every single one of these roles, right? We gave you a snapshot of that training, but I just want to kind of stress that you will never just be kind of onboarded and then told, now go and volunteer, right? Like there's more training involved before you actually go and do the thing. But with that, we want to thank you for your time and for your interest in volunteering with us. If you still have questions about any of the roles, because we just gave you a lot of information, you're welcome to reach out to us through our volunteer email, which is volunteer@endoflifewa.org. You will see that email in the notes section under our YouTube video and also in our volunteer page through which you access this video. Thank you very much.
Thank you. Look forward to seeing you.